One of the main issues is the critically ill patients of COVID-19. As we've mentioned time and time, most of them do have comorbid conditions. And so by the time they present to us, you're dealing with a patient who perhaps is diabetic, hypertensive, and that always brings about a conundrum when you're trying to manage such a patient. Additionally, the disease, if we can remember way back about 100 days ago, we thought that this disease was primarily a disease that affects the chest or the respiratory area of your body. New evidence is emerging from across the world that this disease is actually a systemic disease, a disease that has effects on your heart, a disease that has effects on your kidneys, a disease that has effects when it comes to the clotting of your blood and the coagulation of your blood. And so you can imagine in terms of critical ill patients, we're seeing a mixed picture, and the DG will emphasize more on this and elaborate on this. I'm familiar with patients who've presented with clotting issues. I'm familiar with patients who've presented with, managing their comorbid states as well as managing COVID-19. We are familiar with patients who seem to be presenting with inflammation of the heart. People who are not hypertensive, people who are not diabetic, people who don't have any other comorbid condition, but COVID seems to be affecting their heart, therefore making it even that much more difficult when it comes to managing a critically ill patient. What we can say, however, in terms of our different facilities across the country, particularly facilities that have perhaps now experienced more of the critically ill patients, I'm talking about Aga Khan, I'm talking about KU, KNH. These facilities right now do have one of, the most experienced health workers when it comes to managing a COVID critically ill patient. And the healthcare workers there continue to inform us that they are able to, do the best that they can, offering world-class care to the patients that we get. Of course, over the time we've emphasized that the ICU bed is critical, getting ventilation support is critical, but like raised by Graham, we are seeing other presentations beyond the need for that ventilatory support. And so as we go about the disease, as we try to manage this pandemic, and as new information becomes available, we'll continue to manage the patients as best as we can, and we are doing a good job of that. It's interesting to note, perhaps, and the DG will emphasize here, I'm aware of some good survival rates in some of our hospitals here in Nairobi, especially at the ICU level. Where we've even had discharges home from ICU. So our healthcare workers are doing a good job. Emmanuel Tor asks a question on occupational health hazard. Are we recognizing this much like the way ILO has recognized it as an occupational health hazard? And what we're doing here is reviewing to see what that would mean in terms of the fiscal space, in terms of allocations for that. And there are teams looking to see, in terms of Kenya, workmanship hazards and compensations, what can be put in place to ensure that our healthcare workers are protected. What I'd request is once the teams finalize looking at this, we'd be able to then firmly communicate and confirm if this would be provision that's allowable for our healthcare workers here.